As a researcher, even though I can't keep up nearly the level of reading and understanding that I did before, I've still done quite a bit of research. I'm angry. How's that for? I mean, the whole thing with the CDC, and when I learned, at some point I learned about the, Plum Island and the research. I watched the movie Under Our Skin, and I think that's where I first learned about that. And I'm like, you've got to be kidding me. And, and that they had these U.S. guidelines that totally disagree with the international guidelines for treatment, and the U.S. won't accept that. And there's a woman in charge of writing and approving the U.S. guidelines. She's in charge of writing them, and she's also in charge of approving them, so she has a conflict of interest, and nobody's doing anything about it, except acknowledging, oh yeah, we think 300,000 people more a year are getting infected, and they're still clinging to that idea that we can treat it with 3 weeks of doxycycline. It's insane. And so when I heard, this is an anecdote, I don't know, I haven't looked into it, but I've heard that there is a lawsuit of Lyme patients against the CDC, and I'm really glad to hear that. They aren't going to be able to keep this quiet forever. I think People magazine has kind of taken this on a little bit because they're airing a lot of stories about celebrities and their battles with Lyme disease. So it's starting to get out there, but that doesn't change things on the level of on the street. None of my treatment's paid for, even though I have good health insurance. No doctor that I know of who treats Lyme will take insurance. They really kind of can't, because Lyme isn't recognized as by the CDC as an illness. I'm lucky that they've continued to pay for a long course treatment of antibiotics, and they do pay for the blood work, and they do pay for the brain MRIs, and so. But that being said, I'm spending at least a quarter of our income on Lyme disease treatment, and my husband's had it. About to hear, because what I'm feeling right now, I want to get better. I want to get better yesterday, and then I hear people on antibiotics for 5 and 10 years and nothing. I'm like, I just can't do this for 5 or 10 years. And I really understand why the risk for suicide is super high in Lyme disease, with the lack of social support, the lack of any kind of support, really. I mean, and depending on how your family treats you and how much money you might happen to have, but some people just don't have any money. I mean, one girl put online, she's like, well, I've been saving to go see Dr. Sucher for her first appointment, but from what I'm reading, what's going to be the point? Because I can't afford the $400 a month for the supplements and the ongoing visits and what do you say? There's nothing. Well, I guess I'm a socialist. I'm an advocate for national health care, and this stuff, whatever's going on with Lyme, it's dirty, it stinks. There's something. I don't trust the government a lot. You can put that in there. I still vote. I still do what I'm supposed to do. I follow the laws. I'm not in any subversive groups, but I don't trust, that I hear that conflict of interest, and I read about Plum Island, and I'm like, yeah, I believe that. Because, one article, and this really struck me, they said something happened about 40 years ago. And it changed. Lyme disease has always been in existence, but suddenly something happened so that it couldn't be cured, that it morphs, it changes form, it hides, it does all these things that keeps it from being treated. And if that was done through government bioterrorist research, I could see why they might have an interest in not acknowledging that. Do I know that happened for a fact? No, I'm just willing to believe it. One of the things I learned that was interesting is it's not just bacteria in your body, that the bacteria form in colonies with other things and they have brains. They think they're inside these biofilms to protect themselves, and they send. I have also chronic Epstein-Barr, which is mono, and cytomegalovirus, and I think those are kind of the main things. And I went to Arizona to see a specialist. He wasn't very nice, but he was probably a good doctor. And he found some parasitic plant fungus, not surprising, and candida, which is really common, but he found those in my biofilm. So they added a couple more supplements to the 50 or so I take every day to help address those. So these colonies that are containing the Lyme are hiding all throughout my body, and what they all think together, and you send in an antibiotic or a combination of things, and they send somebody out to the front line to attack or to fight it. And when it's not winning, they pull it back and they send somebody else out. So I'm really not feeling a whole lot of confidence in the let's take antibiotics and keep rotating them and changing them and rotating them and changing them, because it's like, well, they're just going to keep fighting. It feels like a losing battle. At this point, I'm starting to look into Rife machines, which are even more alternative. But my doctor does support that, so I'm going to talk to her about that and kind of proceed cautiously there. But